organization in charge of accrediting Mountain State Health Alliance is now aware of an 89-year-old woman's fall inside an operating room at Johnson City Medical Center. Good evening, I'm Sarah Diamond.
I'm Josh Smith. The family of that patient sent Nate Morabito a copy of the letter they say they mailed to the Joint Commission.
This is the letter sent to the Joint Commission along with pictures of Melba Lowe's injuries. Once a complaint is received, the accrediting organization reports it immediately gets its Office of Quality and Patient Safety involved to assess the organization's overall compliance and verify improvements to prevent a similar situation.
Up until this point, nobody listened.
Now that Karen Mazie and her brother know what led to their mom's fall from a stretcher during a routine endoscopy in the operating room,
I feel more at peace now.
they're just about ready to move on.
I feel like that somebody actually now listened.
But not before more people listen to their story. Mazie says she mailed this letter to the Joint Commission in recent days, telling the accrediting organization, among other things, her moderately sedated mother fell, resulting in these injuries, and adding it wasn't until we got involved that the family found out someone in the OR took his or her eyes off of her mother in the moments before the fall.
I just want them to check into it to make sure that they feel like everything was done that could be done, and that there's a procedure in place now that would ensure the safety of the patients.
We have a process to make sure there's an investigation, there's corrective action, and that our governance is notified of what occurred and what was done to make sure that it was corrected.
Mountain States Health Alliance CEO Alan Levine told us not only is the health system now better prepared to prevent this kind of fall in the future because of its process, the Joint Commission reviews that process to make sure Mountain States follows it.
I feel really good that we do that pretty well.
While a spokesperson for the Joint Commission told us all complaints are confidential, she added depending on the nature of the situation, the organization could initiate one or more of these actions if the complaint relates to a Joint Commission standard. From something as simple as requiring a response or entering the complaint into a database to visiting the hospital, immediate investigation and response. Nate Morabito, News Channel 11 in your corner.
A Mountain States Health Alliance spokesperson told us the health system is not required to report falls to the Joint Commission and did not in this case, but did alert the Quality Committee of Mountain States Governing Board.